Alright, so we're getting to look at another X-ray feature of like bone issue. So this is what is known as sclerosis or cyst. Sclerosis or cyst. Alright, if you see them on X-rays, how would it actually look like? Alright, so for sclerosis or cyst, you could see that this one is what? Subchondral cyst. Of course, cyst is kind of like a bone growth. Alright, you see subchondral cyst. It's just to look at how it actually looks like. And this is how sclerosis is kind of like the bone is kind of like wearing away and all of that. Okay, so let's just describe them, how the features will actually look like on an X-ray, so that at least if you are ever confronted by this, you can be able to tackle it. So on X-rays, sclerosis and cysts appear as distinct changes in bone density. So if you see them, there are issues with what? The mineral composition of that bone. Okay, so there's change in bone density and structure, often helping to narrow down the diagnosis. So it will help you further know what is wrong with that patient. Okay, so sclerosis, starting with sclerosis, which is this, we said that you see a normal joint. Now you can see sclerosis, there's issues. Right, will I say the bone is wearing away, or there's further deposition of some things? Right, let's describe. It appears as what? Increased radiopacity. That's alright, it's whiter than the surrounding bone. Indicates that there's abnormal hardening and thickening. So sclerosis, unlike what I said that there's wearing off of the bone, there's like unusual hardening. Some things are being deposited and the bone is becoming whiter than the normal dark bone you see on X-ray. So common causes, that means if you see sclerosis, you are now suspecting any of these things. Alright, it could be bone islands, could be what? Osteopoikilosis, could be healing fractures, could be osteoblastic metastasis. You have cancers from other places now coming to the bone. Could be infectious like sclerosing osteomyelitis, degenerative issues like osteoarthritis, Paget's disease. Okay, so they may be solitary, that's in one place, multifocal, that's different places are affected, or diffuse, depending on what is actually causing it. Then cyst is just like some outgrowths. Alright, so cysts appear as radiolucent areas within the bone, represent fluid filled or empty cavities. So common types, we have simple bone cyst, we have aneurysmal bone cyst, we have subchondral cyst, we have tumor related cyst. Okay, so diagnosis considerations for the cyst depend on the location, on the size and the border. Alright, so CT scans and MRI are just the best to visualize this, then also do some other imaging tests too.